Thank you all for joining us. If you are joining us by phone and on the GoToMeeting, we'd ask you to please mute your phone or your audio device. As we get through, what we intend to do is go through a set of prepared statements, and then we have received a number of questions from you in advance. We've eliminated some that we believe we will have answered through the press conference, and then if you have questions throughout the press conference, please go ahead and submit those questions through the comment section, and Jessica Meadows will read them in the order they're received, and we'll continue to answer your questions until you no longer have any other additional questions. So to begin, as a trusted public institution in our community, I thought it would be of great importance to share our experience over the last couple of days. I would also like to emphasize the reality of the new world we are now in and what we all must continue to focus on for our community to be successful from this point forward. As this pandemic has continued to unfold, at North Central Healthcare, we've been realistic that the day would come where we would have to deal with this virus within our organization. Regardless of this fact, I take no pride in our being first. The unfortunate truth is this virus will impact all of us in some way personally and professionally. I'm here today to offer our perspective on recent developments here and to answer your questions to ensure confidence in our ability as a community to move forward together. The following is a general timeline of events relative to North Central Healthcare in our positive case. On February 5th, 2020, Wisconsin first reported its first case of COVID-19 in Day County of an individual who had recently traveled to China. About a month later, on March 6th, that was a Friday, our North Central Healthcare team opened our incident command structure to start our preparation for an eventual community spread and has continued to meet daily. 3 days later, on March 9th, 2020, the second case of COVID-19 was confirmed in the state of Wisconsin. On March 12th, the number of cases in Wisconsin was growing, and North Central Healthcare moved to implement a number of new operational guidelines to limit the risk of the spread of the infection, including but not limited to issuing a no visitation policy and restricted access to our entrances, organizing all of our 24/7 campus operations including Mountview Care Center, into restricted zones where internal traffic of North Central Healthcare staff was limited and all were screened. At that point, we began screening all patients, residents, and staff based on the CDC guidelines at the time. In the nursing home, this included temperatures and other assessments related to travel. Staff with any positive COVID-19 related symptoms or possible symptoms or travel risks were sent home to self-quarantine according to the guidelines starting at that time. We also canceled all public use of our facilities and moved all staff meetings to virtual or phone conferences to limit the amount of contact internally. The next day, on March 13th, Governor Evers ordered all schools to be closed by 5 p.m. On March 15th, at that point, there were 33 confirmed cases in the state of Wisconsin, but none yet here in Marathon County. The following day, on March 16th, we at North Central Healthcare increased our travel screening to include any travel outside the state of Wisconsin, and further urged staff to not travel outside their home community, meaning where they lived, which was above and beyond the guidance at the time. We began shifting a large number of staff to work from home, and we moved to eliminate all congregate, large group dining and activities within the restricted area, including Mountview Care Center. On March 20th, 2020, the first Marathon County COVID-19 positive case was confirmed. This confirmed case had no known ties to our case that we're aware of, and that person had believed to be traveled outside the area. The employee who has tested positive worked in Mountview Care Center at various times up until they reported symptoms on Monday, March 23rd, 2020. Until that time, they had no known belief to have been exposed and did not have any symptoms. During that shift, the employee had been screened prior to starting and did not have any symptoms at the beginning of their shift. Later in their shift, the employee developed symptoms, reported them, and was sent home during the early morning immediately upon reporting them. Since that time, they have not been in our facilities and are believed to have remained in self-quarantine. Based on testing guidelines locally, the employee called the testing hotline after being sent home and was instructed to self-quarantine and to monitor for a worsening of symptoms. On Tuesday, March 24th is when Governor Evers issued his stay-at-home order to begin on March 25th. The day after, on March 26th, which was a Thursday, after a couple days of worsening conditions, the employee was brought in for testing for COVID-19 based on the testing recommendations and how they were progressing. 2 days later, on Saturday, March 30th, late in the day, the employee received confirmation that they were positive for COVID-19, and our leadership team was contacted and immediately met with local health department officials to begin our process. That same night, NCHD implemented mandatory mask usage for all employees in patient care areas, and residents are now required to wear a mask when they leave their rooms. It is important to note that a large majority of our residents are dementia residents, which presents a real challenge to these recommendations and going forward. On the morning of Sunday, March 29th, 2020, both the Marathon County Health Department and North Central Healthcare began to work to identify and contact individuals who are believed to have been in close contact with the employee to determine needs for further testing and monitoring. Yesterday evening, North Central Healthcare staff proceeded to communicate to all of our staff, residents, and resident families. Early this morning, we released a community press release to communicate with the general public. As an organization, we have increased our protective measures and screening practices even further. We continue to monitor residents and staff closely for any symptoms and continue to urge them to report them as soon as they have any. Our focus will also be on continuing to limit close contact and use appropriate infection prevention practices to further limit the spread. We have set up means to communicate directly with resident families and guardians to provide further updates as more information becomes available. In summary, we've seen firsthand that the challenge of this virus is that the symptoms can first present days after infection. We believe that during this time, people can spread the infection without symptoms. In our initial case, we estimate it could have been around 72 hours in this situation. This is why we will continue to encourage the public to adhere to the stay-at-home order, for us to continue to use the public health measures that are recommended. The virus is here locally, and if you've watched communities across the country grapple with this, the communities that are doing better than others are those that practice high levels of social distancing and staying at home when you don't feel well. Also, it is incredibly important to continue to practice effective hand hygiene practices. As an organization, I believe we have been working beyond the recommendations at each step. We will continue to be hypervigilant. The reality, though, is that this virus is here and will continue to spread within our community, especially so if people don't follow the recommended guidelines to flatten the curve. I would like to end by offering encouragement to our community, but especially our North Central Healthcare team. These are truly unprecedented times. There is nothing to compare this to for many of us. And in times like this, it is important to not let fear grab a hold of us. We can steadfastly rely on the optimism of similar triumphs of past generations in the face of adversity, and in the historical truth that this too shall pass. When you step into the arena as we have now, you have to come prepared, you have to keep focused, and you have to be willing to give it your all. We are ready, able, and willing to knock this thing out here locally. We've got a fight ahead of us, but we will end this point in time with our hands held high. Thank you for all of our staff on the front line. You are the heroes we are putting our hope into, and also thank you to our community for your continued support. With that, we begin to start to take your questions. And with me today, I have Judy Burrows from the Marathon County Health Department to help answer some of the public health related questions related to this case as well.
All right, the first question submitted. Are any other employees at Mountview Care Center currently being tested or displaying symptoms for COVID-19? If so, how many employees?
Over the last couple of weeks, as I said, our screening procedures have resulted in us sending several employees home as precautions to make sure that they don't spread any risk of infection. The symptoms related to COVID-19 are wide-ranging, and that has caused a disruption for us as an organization. And as recommended by testing hotlines in the community, we'll continue to send employees for testing as needed. There are other employees that have been tested that have returned negative, and there are a couple of employees that are having testing pending.
Does North Central Healthcare have a procedure for monitoring employees for any COVID-19 symptoms?
As I mentioned in my statements, North Central Healthcare has been screening, including temperature screenings for almost 2 weeks now of everybody coming into our building. That screening looks at the risk based on travel and then any symptoms that they may be presenting, and not allowing anybody in the building that has any symptoms or at-risk travel. And then certainly anybody with temperatures have been turned away. We'll continue to do that screening and plan to continue to do that for the foreseeable future.
If residents do display symptoms and/or test positive, how will North Central Healthcare work to isolate that person while continuing to care for them?
You know, we believe as we watch other communities across the country and even in the state of Wisconsin that the day will come when we will have positive COVID-19 residents and patients within our four walls. We're prepared for that, as any healthcare provider in the state of Wisconsin and across our nation is doing right now. That requires heavy vigilance, the proper amount of protective equipment, personal protective equipment, and to make sure that our facilities are ready to quarantine that person and isolate them in place and use the proper precautions to limit the spread of infections. We will continue to care for them in place using those guidelines, and at such point that they need higher level medical care, we will work with our local medical community to be able to get them in higher level care when that's necessary.
Have other programs changed operations to prevent the spread of COVID-19?
Our entire organization has really pivoted over the last couple of weeks. We made a big move over the last 2 weeks to shift a huge amount of our workforce to be working from home. That includes a huge contingent of outpatient and community mental health professionals. It's very important for our community to know that we continue to provide services. We're doing a lot of that virtually or through telecommunications where that's possible, while still providing the 24/7 care here on our campus and in other locations throughout our 3-county area. We have 21 total locations, and all of them are operating at various different levels using appropriate screening and precautionary measures where that's indicated.
How many residents are currently at Mountview Care Center?
Currently, we're caring for over 160 residents at Mountview Care Center and have the capacity to take up to nearly 190 residents.
Under DHS guidelines, will any residents be able to get tested?
So with any resident or staff member that we believe has possible exposure, we contact the testing hotlines that are available in our community and walk through with those professionals and let them walk us through the guidance of when testing is appropriate. We'll continue to use precautions for people that we have maybe a suspected case and continue to monitor their symptoms and take all precautionary measures to keep people safe until we get to a point where testing is indicated. Okay, so we'll switch it over to Judy. There's several questions for the Public Health Department.
So one of the questions that has been asked is about the second case in Marathon County, and yes, the employee of Mountview is the second case that has been reported. We have not been able to determine how this individual became infected with COVID, and so we are now making the assumption that we have community spread. That is basically the definition. When we cannot identify how an individual gets the disease, then we know that we have a good indication that there is community spread, which means that we don't know where it is, we don't know in which places it is and which places it isn't, and so we need to be even more diligent about social distancing and infection control practices that keep every single person healthy. We have been working with the individual in order to identify people that this employee has had close contact with, so friends and family, the places that the employee has been, the people that the employee has been with, in order to determine what other people may have been exposed when this employee was contagious. The employee does remain isolated at home, and so we are confident that the employee is not continuing or furthering the spread of the disease in the community. So related to the concerns about the nursing home, a question was raised about the concern for nursing home residents. Our concern is, of course, that the nursing home, like all nursing homes, we have people of older age, which is, and what we've seen is people who are older tend to have poorer outcomes with this disease. Also, there are more chronic conditions involved in that population, which can complicate the disease process. So we need to be careful and watch carefully and make sure that those folks do not or remain asymptomatic.
Question came in from WSAU. How does Marathon County Health Department go about informing residents that they may have had contact with someone that tested positive?
We rely on first starting with the employee, and we've talked with the employee to identify all of the people that that individual's had contact with. The employee has provided us with information about those people, so we call them and we talk with them about the contact that they've had. They describe when they were together, what kinds of activities they were doing, and we determine whether or not it's considered a close contact, meaning is it close enough where we're concerned that disease would be transmitted, or was it more of a casual contact where it was just in passing and the likelihood of disease transmission is different.
Great. Well, it doesn't look like we have any questions at this point further from the media. Again, we appreciate all of your interest in the story and getting the accurate information out to the community so that they can take the appropriate measures to limit the spread here within our community. If you have additional questions and want to follow up, please reach out to Jessica Meadows and we'll be able to get you answers to any follow-up questions. Thank you again and have a great day.